how not just living, but also the quality of living is important. You're actually treating the quality of life of everyone around them as well.
Hi Arohi, can you introduce yourself and which year you're studying?
Hello, my name is Arohi Vardhan. I am a final year resident in psychiatry here. And yes, today we are here to talk about what we do.
Can you tell me why you chose psychiatry as a career option?
So the thing that worked for me before I was about to choose psychiatry was my work experience during my internship. So during our UG days, in our undergraduate MBBS time, we're not taught as much of psychiatry. But when I got introduced to psychiatry, its working and the impact it has on people and their life, I knew that this is the field that I want to be in.
So do you think psychiatry residency is easy?
No. Contrary to the popular belief, psychiatry residency is definitely not an easy residency to be in.
So does it get better with time? What about first year, second year, third year? Is there a difference?
It is quite different as we go through different years. A, because the work experience gets added to the kind of knowledge that we are also getting while practicing. And B, you sort of get other people who are working with you, and so you are able to calculate all of it together. The interview, which is very unique thing in psychiatry, becomes less time taking as we go through different years in psychiatry.
So what were some of the challenges that you faced after taking psychiatry as a career option?
So my batch of joining was 2020, which was the COVID year. So we also had a lot of patients coming up with COVID or after COVID. We also had the mental health burden along with the burden that all the doctors were facing because of COVID duties and as well. That was a big challenge. And the second challenge that we face, which is very unique to psychiatry, is that sometimes the emotional turmoil of other people can play a bit of, it can affect you as well. So that was something that we learned over the period of 3 years, that how to dissociate between the two feelings, what you're feeling and what your patient is feeling as well.
So what are some of the things you do as a psychiatry resident to protect your mental health?
When it comes to me, I'm very close to music. So going back home, listening to music really helps me out to filter the thoughts that I'm going through at that point of time. Having a good support system in terms of your friends and your people around you does help you a lot. A good change from time to time, not just your work life, but also having a good personal life helps to balance it.
So what's the best part of being a psychiatrist?
The best part of being a psychiatrist, which sort of dawned on me on the later part of my final year residency, is that how not just living, but also the quality of living is important. And once you treat a patient, you're not just treating one person, you're actually treating the quality of life of everyone around them as well. It seems like you're balancing out, you're treating one person, but you end up treating a lot of people who are associated with that person. That's something that I found unique to psychiatry, and it's beautiful.
So what's a busy day like for you?
We have something which is called as an emergency on-call duty day. So that day starts with us treating patients in our outpatient department, seeing them there, and then that continues with us having what we call as consultation calls throughout the day, and that can continue 24 hours. The day does not end there and continues on the next day and ends around 36 hours later. If the time permits and we're lucky, we might catch on some sleep that night, but most of the time it doesn't happen.
So what's a free day like for you?
A free day is a rarity in residency, but on those some lucky days that we did have as free, for me it works out as getting up, finishing up the rounds and coming back a bit earlier than usual. Then that continues as me following my hobbies related to music, reading up a bit, preparing for the next week of acads, looking after if there is any pending work of related to academics and non-related to academics. Definitely going to a beach if possible, because Manipal beaches are amazing. And lastly, catching up a movie if I can.
Given that medical education is so costly, especially in private colleges, do you think a psychiatry degree and education is worth it?
So the experience that I have had till now, I feel the skills that we learn over the years is definitely worth it. The degree that we get after the year is 200% worth it. As about the cost effectiveness of the degree, that I feel I would be able to answer better maybe 5 years down the line. So whether the return comes back or not, in terms of satisfaction, yes. In terms of cost, Not so sure.
Thank you. Have a nice day.
Thank you.